All right, here we are. We're going to do the rotator cuff muscles now. So we'll do supraspinatus first. I've moved on to the blue tape now, and it makes absolutely no difference in terms of colour to the tension of the muscle or the properties of the muscle, okay, of the tape itself. It just happens to be purely cosmetic. So if you like blue, that's the reason you're putting it on. No other reason but that. All right, so supraspinatus, obviously we're coming along the supraspinatus fossa and out to the lateral part or anterolateral part of the shoulder. Trigger points are obviously just where it disappears into that fossa and underneath into that subacromial space. And then we have another trigger point back here. And we can also have another trigger point just at the side of the attachment. So you can decompress anywhere where you feel those trigger points are at their most hot. So the taping technique is going to start at the deltoid tuberosity. Okay, so anchor down there, pull back our backing tape again, and then we're going to bring Leah into some stretch on supraspinatus, so a little bit of flexion, and then once again, as I said, a little bit of horizontal flexion, and then we're going to follow that line across the top of the subacromial space and then along the belly of the muscle itself, like so. Terrific. Our decompression, obviously now, is going to go over wherever they feel the trigger point site. So if we're looking at that trigger point, that second trigger point where it just ducks away underneath the subacromial space, then we can place it straight over there. So again, tear from the middle, peel out 80 or 90% and then back down. Don't forget, it's not unusual for people with trigger points in the supraspinatus that will refer specifically right into that lateral elbow. Okay, so stretch, bit of horizontal flexion across the body, and then starting at that deltoid tuberosity up and over, follow the belly of the muscle, and then obviously the trigger point site will be wherever your palpation is.